Hey guys, I just want to do a real quick video over the medical section. And this section can be really hard or tricky or nerve-wracking, or some people who are brand new, they can kind of get into their thoughts during this section. The main thing is to know that this section, yes, the main purpose is to find out if it is immediate or ROP. But psychologically, not the point of the medical section. So as you're going through here, I'm just going to start from the beginning. The first thing that we ask, have you used any tobacco or nicotine products? Okay, I want to challenge you. Don't put a time frame on it. Ask them, have you ever used any nicotine or tobacco products? Some people say no. You say, okay. We're not saying okay, good, because this portion is all about not praising. If they say yes, you're like, okay, thanks, Mary. When did you or do you still smoke? Oh, well, I currently smoke. Okay. Flat. How many cigarettes do you smoke a day? Do you think a pack, 2 packs? How many do you smoke? A pack a day? Wow, okay. What about weekends when you're around friends and family? Do you smoke a little more? Yeah, I probably smoke about 2 packs a day on weekends, especially if I'm out. Okay, wow. Mary, how long have you been smoking? Oh, goodness. Probably since I was 18. Wow, Mary, and you're 65? That's a long time to be smoking. Thank you for your honesty. Now, what's your height and weight? Move on. Okay, and what's your date of birth? Get the date of birth. Now, Mary, I'm going to read you a few medical questions, and it is my duty, and I take it as a responsibility to fill out your application properly. So I'm going to be very thorough with your medical questions, and the first few are going to sound familiar, but we'll get through them in just a few moments and move on, okay? Read the DNQ questions, and now we're into 4, 5, 6, 7, 8, 9, 10, okay? Anytime they say yes to something, you need to act like it's the first time you've ever heard that. Okay? We're not complimenting them or praising them on their health. We can praise them on what they're doing to make their health better, but we're not going to praise them on being better. Okay? No one's healthy. So, diabetes, I hear this all the time. Mary, have you been medically diagnosed or treated for complications of diabetes? Oh, yeah, I just have a little bit of issue with my sugars. Oh, wow, Mary. When did that start? Oh, my goodness. She's going to give you a time frame. And then she'll probably say, well, with exercise and diet, I don't have an issue really anymore. I'm hardly taking any medications. Well, Mary, I'm happy that you're taking your health so serious. Now, the next part of my question is all about complications. I pray you haven't had these. Now, have you had insulin shock, diabetic coma, retinopathy in the eye, nephropathy in the kidney, neuropathy, which is nerve damage or pain? It can feel like a tingling or burning sensation in your hands or your feet. Or have you ever used insulin prior to the age of 50? Well, I do have some pain in my hands and feet, but I don't know if it's neuropathy. Mary, are you serious? Wow. Okay. Mary, I'm sorry that you're feeling that pain, and I'm sure it's very difficult. But if you were to be diagnosed with neuropathy, I don't know if I could help you. There's a lot of companies out there that do not accept people with complications of diabetes. I'm very soft about it. Very soft, gentle, and just genuine. And then move on. Don't let them respond. After you say that, just say, okay, now have you ever been medically diagnosed, treated, or taken medication for renal insufficiency, kidney failure, chronic kidney disease, or more than one occurrence of cancer in your lifetime? They're going to say no, hopefully. But we know that diabetes affects your kidneys, so circle back. Mary, I know that having diabetes can take a toll on your kidneys. And that question pertained to kidney failure. Has your doctor checked your kidneys? Yes, he has. I'm fine. Okay, thank you. Notice, I'm not saying time frames. Next, have you had any diagnostic testing, whether it be a surgery, hospitalization, or been advised by a medical professional which has not been completed or for which the results have not been received? No, I don't have any tests. Okay, cool. Thank you. I say thank you to everything. Not okay, good, not wonderful, just straight to the point. Okay, thank you. Now, next one. Have you been medically diagnosed or treated for angina, chest pain, stroke or TIA, cardiomyopathy, systemic lupus, cirrhosis, hepatitis C, chronic hepatitis, chronic pancreatitis, liver disease, ulcerative colitis, chronic obstructive pulmonary disease, also known as COPD? And Mary, a lot of people who I speak to who smoke, they have COPD or emphysema, chronic bronchitis, or some even require oxygen equipment to assist in breathing. Do you have any of that? Oh, no. I haven't had any of that. Okay, well, Mary, with how long you've been smoking, I'm glad that you haven't so far. I pray that doesn't happen to you. And if you have a story of someone who does smoke, my grandfather, he was a smoker. He died because of cancer. You might put in a quick little 2-sentence story. Thank you, Mary, for sharing that with me. I am glad you haven't had that issue yet, because my grandfather, he was a habitual smoker. I mean, he smoked for 30 years. A pack, 2 packs on the weekend. Make it sound like their scenario. Put in a little story. And then, have you taken medication for any form of cancer? Next, again, no time frame. Have you had a heart attack, aneurysm, or any type of heart, brain, or circulatory surgery, or any procedure to improve circulation? And you read off the in-betweens, the defibrillator, the coronary artery bypass, all that good stuff. Then you ask them, Mary, when was the last time you checked your cholesterol or blood pressure? Oh, it's been a while, or, oh, my last physical. Everything's fine. Everything's good? Everything's good. Okay, good. I'm so glad to hear that. Did you know that smoking is one of the top reasons for people to have strokes and heart attacks? Because your arteries actually harden. Keep going to the doctor and getting those regular checkups. That way, if something does happen, they know. Now, have you used illegal drugs or abused alcohol or drugs, or had or been recommended to have treatment or counseling for alcohol or drug use, or have you been advised to discontinue the use of alcohol or illegal substances or drugs? No. Everyone always says no. Every once in a while you get the marijuana one, then of course we need a little extra information. Last one. Have you been medically diagnosed or treated for paralysis of 2 or more extremities, cerebral palsy, multiple sclerosis, seizures, Parkinson's disease, or muscular dystrophy? Most of the time that is no. Most of the time that's a no. But if anything, if seizures pops up, that's one of the ones I see the most. Muscular dystrophy, multiple sclerosis, things like that are the ones that I see the most. So in other words, seizures, I would say, wow, oh my gosh, that must have been so scary. What happened? Then they go into, I didn't know what was going on. I fell down. I might ask them, did you pass out? Did you go to the ER? What did the doctor say? What did the doctor do? Gosh, I bet your kids were terrified. Just simple little things like that. Always relating back to family. Always relating back to how they felt, what they were doing. And sometimes, I'd even tell them, wow, Mary, who would have thought you'd have a seizure? I know for a matter of fact, you never thought you did, would you? We just can't take our health for granted, can we? It can change at any moment. So, Mary, do you take any prescription medications? Okay, go through all the medications. Okay, there's a few different medical takeaways that you can do while you're on the medications. Mary, people who experience complications of high blood pressure will experience complications again. It's only a matter of time. Please don't skip your medication for that. What's your next medication? Say it's gabapentin. Wow, that's a serious drug. I'm glad that it has your diabetic complication under control. Please do not stop taking that. There's people who lose limbs. There's people who have kidney failure. Please do not stop taking that medication. What's your next one? Cholesterol. You know, Mary, the fact that you've already started to experience some complications of high cholesterol, you know, when you put that with high blood pressure and diabetes, that puts you at a high risk for a heart attack or a stroke. I'm not sure if I will be able to, or I'm not sure if I'll be able to get you accepted, but let me see what I can do for you. We have to try. Now, when you're going through the medical section, you don't want to use all of these at once. I'm just trying to give you multiple different examples of how you can do a medical takeaway in the script. But now we're going to get down to an actual medical takeaway. I'll give you just a few to keep the video short, but this is how you create urgency, okay? The medical section is all about sitting up straight. You put your doctor's face on. You know, doctors aren't normally joking around about blood pressure, laughing, or anything like that. They give you a medication and move on. So here we are. Well, Mary, thank you for your honesty. I know, punch that word, I know you've been thinking about this a lot lately, and I want you to know that I'm here to help you. However, Mary, shh, small words, whisper, there are some concerns here that may cause a red flag with the insurance company because you're 65 years of age, you have high blood pressure and cholesterol issues. Now, I know that it might not seem like a big issue, but to insurance companies it is, because you state what your red flag is, and you say because, Mary, when you put those two things together, it raises your chance of a heart attack and a stroke by 500%. And Mary, you smoke. So your arteries are not going to be what they used to be. Now, I can't make any promises, but I will do everything I can today to get you approved. And just in case I can't, Mary, can you promise me one thing? Most of the time they don't say anything. They're like, I don't know. I don't know what it is. Can you promise me that you won't be upset with me if I can't? Now that's the script. Now I always add in something about their family. Can you promise me that you won't be upset with me if I can't? I know how much your family means to you, and this plan is. Please don't be upset. We want them to say, oh, honey, don't be upset with me. It's not your fault I'm sick. If you get anything other than that, you have work to do. And then you say, okay, thank you, because I'm here to help you, and I'm going to do everything that I can today to get you covered today, okay? Just like you're asking your best friend something really, really important that you really want them to say yes to, and that don't worry about it, I'll take care of it, or don't worry, it's okay. But then you're like, okay, thank you, because honestly, I'm going to do everything I can to get you covered today. So that was cholesterol, high blood pressure. Now smoking. You know, Mary, I can't make any promises. Whoop, back up. However, Mary, there are some concerns here that may cause a red flag with the insurance company. The fact that you're 72 years of age and you've been smoking since you're 18. Mary, not only is your age a concern at this point, but your lungs, your kidneys, your skin, your whole internal body is a concern because of the smoke you've been putting in for years. I can't make any promises. No medications, no health history. Mary, there are some concerns here that may cause a red flag with the insurance company. Because you're over the age of 50, we're closer to the finish line. That's a red flag. And honestly, the fact that you don't have medications as preventatives to help your body continue to work the way that it's supposed to, 75% of people by the age of 50 have at least a preventative for high blood pressure and cholesterol, and you have nothing. Preventatives are what keep us alive, most people. And you even said that you have some issues in your family health history. I can't promise anything. Move on. What about the person who doesn't care? Just slip something in. There are concerns here. The fact that you've had seizures. You have AFib, which means your heart is not beating properly. And you've passed out because of diabetes. That's a big red flag. Honestly, those people, I would lay into them, but gently. That's a red flag to the insurance company, because with seizures, if you have one while driving, you could die in a car. The AFib, your heart's not pumping properly. You're a walking, talking heart attack. And the fact that you have complications of diabetes, 65% of people who have diabetes die prematurely due to strokes. And you have AFib. And you have seizures. I don't know if I can get you qualified today, but I will do everything that I can. Just please don't be upset with me if I can't. Oh, honey, I don't care whether you get me qualified or not. Well, Mary, I understand. I understand how important this plan is to you, because you love your family, and that's what this is all about. Your family and protecting them. So I'm here to help you, and I'm going to do everything I can today to get you covered today. Okay? Okay. Move on. But we want to build the urgency. Why? Because these people don't have time to think about it. These people are professional thinkers, professional procrastinators. We need to show them it's today or never. We are one-call closers. Either they die, buy, or hang up the phone. I would rather have someone hang up on you at the medical takeaway than to spend an hour with them for them to tell you, yes, I have AFib and diabetes, and I've had 3 heart attacks or stroke and high blood pressure, cholesterol, nitro, insulin, and whatever else. But I need to talk to my daughter. What do you need to talk about? Nothing. Because, Mary, you have waited 72 years, and now you have AFib. Now you have high cholesterol. Is there any reason that you would not want your daughter to have this money at your funeral? We need to show them that this is urgent. But you gotta believe in it, that it is urgent. Now get out there and have some good medical takeaways.